Hi sir, good morning or good evening. This topic is all about immunodeficiency. Immunodeficiency is a failure of immune system to protect the body from infections. It's because of the absence or insufficiency of some component process. Means ito yung immune system or nalalak siya is because of kulang or shortage doon sa ating immune system. That's why nagkakaroon ng failure sa ating katawan. It's because of shortage or lack of immune. It can be lose the ability to fight the infectious disease. That's why we call immunodeficiency. So, immunodeficiency is a state in which the ability of the immune system is compromised or entirely absent to fight against infectious disease and cancers. Kaya nga, yung sinabi ko ay pag immunodeficiency ka, it's because of shortage and lack of immune sa ating katawan. So that's why we are able to lose the ability to fight the disease or infection disease. As we can see, these are immunodeficiency causes. A weaker immune system is typically caused by certain disease, malnutrition, and certain genetic disorders. Syempre, ang causes niyan is because of the certain disease and malnutrition. At saka pagkakaroon ng genetic disorders. And syempre, I show here pictures, and as we can see in this picture, it shows frequent symptoms that are common for immunodeficiency, such as chronic cough, breathing troubles, pain in the ear, and nausea, vomiting, and diarrhea. And also, weight loss. Siyempre, pag weight loss ka, siyempre, very common naman yun na immunodeficiency ka. It's because of a shortage of lack of immune system. Kagaya ng sinabi ko kanina, it able to lose the ability to fight the infectious disease. That's why we are able to call immunodeficiency. Okay, let's proceed to the classification of immunodeficiency. Primary immunodeficiency and secondary immunodeficiency. Okay, let's talk about the primary or congenital or inherited, or which means a primary immunodeficiency. Primary means the disease does not result from another illness or conditions like a tumor, kasi congenital siya means it present at birth. Congenital is a disease or a physical abnormality present from birth. Syempre, there's factors na nagkakaroon ng kagaya ng sinabi ko kanina, lack of immune system, or there's walang ability to fight the disease during in the development. Cause of mutations genes involved in the development and functions of immune organs, cells, and molecules. During the development, there is a failure that the immune systems are not able to fight the disease. As we can see in the pictures, this is the physical abnormalities na nagaganap. It's because of losing the ability to fight the disease during the development. Kaya as we can see, there's in the pictures ay ang mga bata ay nagkakaroon sila ng physical abnormalities during the development of their parents na some for reason na there's a failure na nagaganap doon during the development. Uulitin ko po, kaya siya tinawag na primary immunodeficiency dahil po ay it present at birth or inborn. Okay, dadako tayo dito sa primary immunodeficiency. Is subdivided into types that cause the T cells deficiency, B cells deficiency, both T cells and B cells deficiency, complement deficiency, phagocyte deficiency, and immunoglobulin deficiency. T cells fight intracellular microorganisms including fungi, viruses, and also tumors. B cells defect include recurrent infections that are typically encapsulated bacteria. Ganun pa man, dahil deficiency means loss of ability to fight the disease and lack of ability na nagkakaroon ng shortage dito sa T-cells. Dahil po ang T-cells ay sobrang halaga po nito sa ating katawan. Lalo na po, ang T-cells ay para ipaglaban ang ating katawan, protektahan sa mga infectious and also to fight those disease. Kaya rin po tinatawag nating immunodeficiency kasi po kulang sa T-cells. Kasi ang T-cells, uulitin ko po, ay importante po sa ating katawan para ipaglaban ang ating katawan sa mga infections and also sa mga disease. Hindi lang po sa mga tao ang nagkakaroon ng immunodeficiency. Siyempre din po sa mga lahat ng organismo na nabubuhay dito sa ating mundo is meron po tayong T-cells, and pagkakaroon ng shortage dito sa T-cells ay hindi lang po tao ang makakaranas dito, syempre din ang mga hayop at anumang may buhay. B-cells deficiency are primarily antibody deficiency leading to recurrent cyanoinflammatory infections producing antibodies. Dahil ang B-cells, ang role niya po is to regulate the immune system by producing antibodies. Antibodies are protein that protect us when our unwanted substances enter our body. Siyempre naman po, kung wala ang B-cells ay nagkakaroon po tayo ng deficiency o shortage, lack of deficiency. Ngayon, ganun din po sa T-cells ay nagkakaroon ng shortage na labanan ang disease sa ating katawan. Pag kinulang po tayo ng B-cells ay matatawag po nating na B-cells deficiency. This is the advantage of B-cells and T-cells. T-cells can wipe out infected or cancerous cells. They also direct the immune response by helping B lymphocytes to eliminate invading pathogens. B-cells create antibodies. Like what I say kanina, yun na yung kahalagahan ng dalawang cells, B-cells and T-cells. Non-infectious immunodeficiency. Not only infectious conditions should raise the suspicions of immunodeficiency, but also manifestations of allergy, inflammation, autoimmunity, lymph proliferations, or cancer, especially if they are recurrent associated to each other, affecting your young patients on a severe or difficult to treat conditions. Non-infectious immunodeficiency, this is hindi siya nakaka-infect or hindi siya nakakahawa sa ibang organismo o sa tao. Okay, let's proceed to the secondary acquired or secondary immunodeficiency. Secondary immunodeficiency or SIDS are acquired declines of immune cells counts and or functions, loss of immune functions that result from exposure to various agents. Immune system compromised by factors outside the immune system such as virus, aging, radiation, malnutrition, severe stress, splenectomy, thymectomy, or chemotherapy. This secondary immunodeficiency is ito po yung nakakawa or nakukuha natin sa kapaligiran unless doon sa primary immunodeficiency. Ang primary immunodeficiency ay inborn siya. Ito naman ay nakukuha natin sa ating kapaligiran such as mga virus, aging, and etc. or others disease na nakukuha natin sa ating kapaligiran. That is the secondary immunodeficiency. Infectious secondary immunodeficiency. Secondary immunodeficiency (SID) occurs when the immune system is weakened by another treatment or illness. The signs and symptoms of SID are the same as for primary immunodeficiency, that is, frequent, prolonged, or unusual infection such as AIDS and HIV. Ito po yung deficiency na natitreat natin but prolonged or matagal. It's very hard to treat. Immunodeficiency can be specific and non-specific. Specific abnormality of B cells and T cells. Specific means ito yung na-clarify or na-identify. Yung non-specific abnormalities of non-specific component is ito yung unidentified or hindi pa na-clarified.
So, good morning or good afternoon, sir. I am Lloyd Ulugin. To continue the discussion on the topic of immunodeficiency, I am assigned to tackle and discuss the secondary immunodeficiency, or also known as the acquired immunodeficiency. The term acquired refers to something that is gained or obtained after birth rather than being present from birth. So hindi ito yung nakukuha natin sa mga kanunuan natin, pero nakukuha natin ito sa ating paglaki. So in the context of acquired immunodeficiency, it means that the weakened immune system is not inherent, but rather develops later in life due to external factors such as infections, medications, or other medical conditions. Now, just like what my co-reporter said or implied, the secondary immunodeficiency are conditions in which immune system is compromised due to factors other than genetic or inherited causes, gaya sa sinabi ko kanina. This can be caused by various factors such as infections, medications, chronic illnesses, or other external factors. So I have here the examples of secondary immunodeficiency disorder or SID. We have the AIDS, cancers, malnutrition, chronic disease, and etc. So, let's discuss causes of SID or the secondary immunodeficiency disorders. So first, let's discuss AIDS and HIV. HIV is the virus that causes AIDS, and AIDS is the condition that develops in individuals who have advanced HIV infection and severely compromise the immune system. Now, first, let us discuss HIV. HIV is a retrovirus that attacks the body's immune system, specifically targeting CD4 cells, which are crucial for fighting infections. So, HIV is primarily transmitted through unprotected sexual contact, like in vaginal, anal, or oral with HIV positive. This HIV is very rampant and relevant nowadays. That's why practicing safe sex should be implemented, because we don't know if a person that we have sex with is positive on HIV. Next is sharing contaminated needles or syringe with an HIV positive person. And lastly is the HIV positive mother to her child during her pregnancy. So now let's discuss the AIDS. AIDS is the most advanced stage of HIV infection, when immune system is severely compromised, making the body susceptible to various opportunistic infections. And while there is no cure for AIDS, it remains crucial for managing the HIV infection and improving overall health. However, individuals with AIDS may also require additional treatments for opportunistic infections and other complications. Patagal ng patagal, pahina na din yung nagbablock ng mga sakit, ng mga sakit. Yan, hindi yung AIDS ang pumapatay sa iyo, pero yung mga opportunistic infections ang unting-unting pumapatay sa iyo. Next, let's discuss the cancer. Cancer is a complex disease that can be caused by a combination of genetic, environmental, and lifestyle factors, such as the genetic factors, environmental factors, and lifestyle factors. So, cancer is very talaga ngayon, kasi hindi yan maiiwasan if a person is having a cancer. And cancer is walang pinipiling edad, kahit matanda man yan o bata. Next is the malnutrition. Malnutrition refers to a condition where there is an imbalance between the nutrients a person consumes and the nutrients their body needs for proper growth, development, and overall health. Malnutrition can result from both undernutrition and overnutrition. So, lastly, we have here the chronic disease. Chronic disease, also known as the non-communicable disease, or NCDs, are long-lasting conditions that typically progress slowly over time and may persist for years or even a lifetime. These diseases often result for a combination of genetic, environmental, and lifestyle factors. I have here the feature and description which shows the overall data and overall characteristics of secondary immunodeficiency disorder. First, we have the type. So it is acquired or developed later in life, and cause, underlying condition or medication or lifestyle factor weakens the immune system. Example of causes: disease, HIV, AIDS, diabetes, malnutrition, chronic kidney disease, and cancer. For the symptoms: frequent, prolonged, or unusual infections similar to primary immunodeficiency. Diagnosis: medical history, physical examination, blood tests, and sometimes other tests. In treatment naman, addressing the underlying cause, manage symptoms, example, antibiotics, vaccines, immunoglobulin therapy. Lastly, for the comparison to primary immunodeficiency, primary inherited affects development of immune systems. Then we have the diagnosis of secondary immunodeficiency or SID. Diagnosis on secondary immunodeficiency involves through medical history, physical examination, and laboratory tests to evaluate the immune system function. It is important talaga that we need to undergo a examination para ma-identify na kung may secondary immunodeficient ang isang tao. So you need to complete your blood count or the CBC to check that for abnormalities in white blood cell counts. Next is the immunoglobulin levels, assess the levels of antibodies in the blood. Next, for the flow cytometry to evaluate the function of immune cells. Skin test to assess the immune response to antigens. Chest X-ray or CT scan to check for signs of infection or inflammation in the lungs. And HIV testing to rule out primary immunodeficiency caused by HIV infection. Lastly is genetic testing to identify an underlying genetic disorders that may be causing the immunodeficiency. So I have here the data on the treatment of secondary immunodeficiency. So we have the first category, addressing underlying cause if possible. Treating the underlying disease or condition that is weakening the immune system can significantly improve immune function. An example of that is treating HIV or AIDS with antiretroviral therapy to control the virus. Next is preventing infections. Vaccination against common infections can help to protect individuals with SID. Prophylactic antibiotics may be prescribed in certain cases to prevent specific infections. Good hygiene practices, frequent hand washing, and avoiding contact with sick individuals and practicing safe food handling are crucial. Examples is vaccination against pneumonia, influenza, and other recommended vaccines, prophylactic antibiotics to prevent recurrent urinary tract infections or UTI. Next, we have the immunoglobulin replacement therapy, replacing or macing or deficient antibodies with intravenous V or 4 or subcutaneous immunoglobulin LG infusions can be immune function and decrease the risk of infections. Example with intravenous immunoglobulin LG therapy every 3 to 4 weeks. Next is the nutritional support. Ensuring the adequate intake of essential nutrients is crucial for optimal immune function. These may involve the dietary counseling, nutritional supplements, or enteral or parental feeding if necessary. Examples is the dietary counseling to ensure a balanced and nutritious diet, vitamin and mineral supplements as needed. Lastly, we have the other supportive therapies. Additional therapies may be used for depending on the individual's needs, such as cytokines. Signaling molecules can be stimulate the immune system, the anti-inflammatory medications to manage inflammation associated with some underlying conditions. The granulocyte colony stimulating factor or the GCSF to increase the production white blood cells, the corticosteroids to manage inflammation and autoimmune disease. These data on all of these are the treatment of secondary immunodeficiency, and it is important to visit our doctor if we feel the symptoms that I mentioned earlier, so that mape-prevent natin yung pag-spread nito. I have here some strategies for preventing immunodeficiency disorders. This includes the maintaining of healthy lifestyle, such as doing vigorous activities, and maintaining balanced diet. Maintaining balanced diet is a must nowadays because diseases and viruses are very rampant, and kailangan natin pangalagaan ang ating sarili para malayo tayo sa immunodeficiency disorder. Next is avoiding exposure to infections. Sinabi ko kanina na avoiding of exposure to infections such as reusing of needles and sharing of utensils. Sa pamagitan nito, na-avoid ka para makakuha ng immunodeficiency disorder. And next, we have the vaccination. In our early ages, pinapavaccinate na tayo ng ating mga magulang para mas mapalayo tayo or mas ma-avoid natin yung immunodeficiency disorder na dala nito. Next, avoiding smoking and limit alcohol consumption. By avoiding smoking and limit alcohol consumption, maiiwasan din natin ang magkaroon ng immunodeficiency disorder. Next, we have the manage chronic conditions and regular medical checkups. Regular medical checkups is a must, lalo na kung tayo ay tumatanda na, and also pag may pakiramdam tayo na medyo mali or may mali na, siguro kailangan na natin pumunta sa doktor, but it's wrong. We need to regular medical checkup so that malalaman natin kung ano ang kondisyon ng ating mga katawan. Next, we have the avoid unnecessary use of antibiotics. Hindi natin alam yung mga ibang antibiotics is nakakasama na para sa atin, kaya we should avoid unnecessary use of antibiotics. By following these preventive measures, individuals can help maintain a healthy immune system and reduce the risk of developing immunodeficiency. So I have here the side-by-side comparison of primary immunodeficiency and secondary immunodeficiency. In primary immunodeficiency, neutrophil defects CJD, the humoral B defects, the humoral complement, cell-mediated T cells, and severe combined immunodeficiency. I hope na-discuss to ng aking co-reporter na si Mr. Saoragal. And on the other hand, we have here the secondary immunodeficiency, the AIDS, the neutropenia, post-transplant BMT, and chemotherapy. The splectomized patient and malnutrition, anti-cancer chemotherapy, and radiation therapy. All of these are connected to secondary immunodeficiency. Now, to sum things up, or to summarize the idea of the secondary immunodeficiency, it refers to a weakened immune system that is not the result of genetic or inherited factors. To clarify, hindi ito yung namamana sa ating kanunuan, and especially hindi po ito namamana sa genes specifically, but rather it is acquired later in life due to external factors such as infections, medications, or other medical conditions. This can result in increased susceptibility to infections and reduced ability to fight against illnesses. Treatment for secondary immunodeficiency typically involves addressing the underlying cause and may include medications, lifestyle change, or other interventions to help boost the immune system. And that's all for the immunodeficiency, the primary and immunodeficiency, and thank you for listening. Again, I am Lloyd Ulugin with my co-reporter Rajmir Sauragal. Thank you and good afternoon, sir.